Hi, I'm Dr. Bob Donatelli here in Las Vegas, Nevada. I'm a physical therapist, and we're here today to talk about a really amazing product I've been using for the last several years. It's called Formthotics. These Formthotics have replaced every other kind of orthotic device in the shoe that I've used over the last 25 years. They are an excellent in-house system of making an orthotic for your patient, and I really believe an in-house system is truly the only custom device that you can make for your patient. You have the patient right there. You can pick the density on these different products, and we have 3 different densities here that we can kind of review. There's this really firm orthotic, single firm, and we have the single medium. Then we have a dual density, which is a combination or halfway between these two. And these are the main 3 I've been using for the past 3 or 4 years, is these 3 different types. The hard, firm orthotic is for those patients that really can tolerate that firm orthotic. Most of my athletes who really pound the pavement in running, in sports that are aggressive, such as basketball, tennis, where they're doing a lot of running and cutting, those are the products, that's the kind of density I'd like to see, because I want to try to control that foot so we don't go into excessive pronation. That is the main reason why I use these products, is for every patient that comes in the office, I'd say for every 10 people that come in with an overpronation problem, I might have 1 come in for an oversupination problem. So those have been mostly described as why the person's having pain. There's much more correlation in the literature as to why a pronator patient, one who has an excessively flat foot, as you know, is going to have overuse injuries throughout the whole limb. I mean, overpronation has been associated with heel pain, plantar fasciitis, medial arch pain, knee pain, in some degree even hip and low back discomfort. There's a number of articles that have been published. Larson published one on the effectiveness of these orthotics, believe it or not, on low back pain. So this kind of hard, firm orthotic I really choose for those patients that are really aggressive, an athlete. Whereas the medium might be for someone who doesn't weigh quite as much, because I get guys in here that are 6'8" basketball players. We work with a company here in Vegas called Impact Basketball Academy, and so those guys I really tend to lean towards this hard, firm orthotic. The medium density is also good. I might choose that for a little less, not as heavy, not as aggressive athlete that I do need to have that control. The control is critical. Remember, we don't want to eliminate pronation, because pronation is a normal part of gait cycle. But what you want to do is try to determine, which we have 7 tests we're going to go through to determine this, to help determine this. How much is the person overpronating? Is the medial arch collapsing? Is the forefoot unstable? Is the rear foot moving into eversion too much? And we're going to try to control those different aspects of pronation through the use of these orthotics. And again, the best way to control that is by trial and error. There is certain objectivity to this, but you then have a product like this that you can make adjustments to, literally every single time the patient comes back. Then the last one that I use is a combination, a dual density. You can actually see it has a blue and red, kind of a little bit of this, a little bit of this. And these orthotics I use for my less active patients that are just maybe walking a lot in their daily activities. They might play, some sports on the weekends, but not aggressively running, cutting, and jumping type sports. So these are the 3 products that I use the most, and I've seen these really help reduce symptoms in the whole lower kinetic chain. And we do have some really good. Hertel published an article, believe it or not, that really an orthotic in the shoe, these Formthotics, which is what we're talking about today, he actually had that in the paper, showed a significant improvement in balance. Now that is absolutely essential for your athletes. That's absolutely essential for everyone. And in the United States, it's an amazing statistic, but believe it or not, loss of balance and falls in the elderly population, 70 and older, is the #1 cause of death in the United States. Not because of the fall, but because they go into the hospital and they develop complications because of the surgical procedure to correct the hip fracture, because of infections, because of pneumonia, right? This is one product that is going to help reduce falls. Why does that happen? According to Hertel, this particular paper, he claims that the proprioceptors under the foot are influenced by the posture of the foot, which makes a lot of sense. We have a lot of proprioceptors, which is part of the somatosensory system, giving feedback into the body as to where the foot position is. And that's one of the reasons why you see an improvement in balance. So proprioceptors are influenced by your foot posture, and these orthotics put the foot in a better position, and those proprioceptors are firing much better. They actually have shown to change. Hertel did it in his paper as well. Believe it or not, they change EMG activity, right? Muscle activity all the way up into the pelvis. And we know that hip abductor weakness, #1 cause of falls in the United States. And besides, again, there are 3 systems for balance, right? Vision, vestibular, and proprioceptors, the somatosensory. But hip strength is essential to maintain throughout life. So we have a product here that, believe it or not, you can change all the way from the foot up to the pelvis by proprioceptive neuromuscular adaptations, which is absolutely essential. So these I use, they're dual density, a little softer, and I think much more adaptable to patients, less active, but we want to control their balance and their function during the day. One of the things I like about the Formthotic is that it accommodates to the foot, right? I've made them. I'm sure people that have made orthotics in the past have used those hard, rigid materials. Cast the foot, send them off to a lab, and they have this plastic material you get back. And the first thing you say to the patients is, you need to wear these as a break-in period. You need to wear these a little bit each day so the foot then breaks into the orthotic. I think that's the wrong concept. The foot should not adapt to the rigidity of that orthotic. The orthotic should be molding to the foot postures of that individual patient. Doesn't that make sense? That is a truly, truly customized orthotic device. When that orthotic device is molding to the undersurface of the foot. We're getting all the contours of the arch. We're getting a deep heel seat, in this orthotic to mold contours of the heel. The forefoot is basically accommodating to foot pressures or toe pressures. And you could actually see it in this orthotic if you put the person in them for a while. It actually has different areas where you see it has accommodated to that person's foot. And that's why I know I'm having these great results with this product. To get a customized device specific for your patient's foot, specific for your patient's pain, whether it be foot pain anywhere in the foot, medial arch pain, heel pain, plantar fasciitis, medial shin splints, medial knee pain, are all associated with an overpronator, and that's one foot that I see 90% of the time that walks into my office. Someone has a foot that is collapsing. Push off, they're not supinated, they're in pronation, pushing off. Probably one of the most traumatic events that the foot has to deal with.